Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Between 2.5 and 3 years of age, the human primary dentition completes its eruption and offers an excellent opportunity for the first exposure of the child to the dentist. Many other major developmental stages will have begun, including walking, talking, self-feeding, and to a certain extent association with other individuals outside of the influence of the family. The following presentation will illustrate a normal preschool child visiting a dentist for the first time. The viewer is advised to observe particularly the interactions of the dentist, child, and assistant, utilizing the techniques of tell, show, and do, while the behavior of the child is guided through reasonable expectations, appropriate modeling, positive association, and continuous reinforcement. One of the most important aspects of a successful dental examination is proper preparation for the patient. In the Department of Pedodontics, special trays are prepared for various procedures that are indicated by way of treatment planning. The examination tray contains a Tarno No. 3 Explorer, a Wesco No. 3 Explorer, a front surface mouth mirror, a Tarno 311-A cotton pliers, a Tarno 1S scaler, prophylaxis paste, and a slow-speed contra angle with a rubber cup. Oral hygiene education materials include oversized tooth models and brush, a face mirror, disclosing solution, cotton-tipped applicators, a plastic cup, a saliva ejector and suction tip, and a toothbrush and paste for the patient. For topical fluoride application, an optional procedure at the first dental visit, the Department of Pedodontics provides acidulated phosphate fluoride liquid to be used when cotton roll isolation is selected. Acidulated phosphate fluoride gel is to be used when full mouth trays are utilized. The following sequence, therefore, will illustrate the child's first visit to the dentist. The child's past medical history is free from rheumatic fever, cardiac disease, or bleeding tendencies. And if a stable home life forms part of her background, the appointment should proceed from beginning to completion without difficulty.
You know what they're doing, don't you? What are they doing? What are they doing?
Hi, Mary. How are you? How old are you now, honey? Can you tell me how old you are?
You're 3 years old?
3 years old.
Are you 3 years old already? Huh? Boy, you sure have a pretty dress on.
Look at those are my new shoes.
You got new shoes, too? Boy, they sure are nice.
Look at.
Mrs. Rogers, how are you? I'm Dr. Pink.
Thank you.
And, boy, you sure have a cute little girl here.
Thank you.
What we'd like to do today is, first I'd like you to fill out this consent form. And then under it is a brief medical history about Mary, okay? And you know what we're going to do, Mary?
What?
We're going to take you in and show you how to brush your teeth. Okay? Come on with me, honey. That's a girl. Boy, you're a big girl. Paulette, this is Mary.
Hi.
Mary, this is Paulette, and she's going to be our helper today. Can you get up in the chair, honey? This is our toothbrushing chair. And our toothbrushing chair moves, the back moves down. The chair moves up. And the back moves down like this. Okay, can you sit up here real big? Oh, that's a girl. Put your hands right in your lap. Oh, very good.
Let me pick up your hair just for a minute while I put the napkin chain around.
That's a spaghetti bib, so we don't get the pretty dress dirty at all. Can you open up real big for me, please? Thank you. Do you brush your teeth every day? Do you have a toothbrush at home, Mary? Can you tell me when you brush your teeth at home, Mary? Do you brush them before you go to bed?
I brush them before I eat lunch.
Before you eat lunch, huh? Is that the only time?
Mm-hmm.
Okay.
When I eat supper, I have to brush them too.
Good. Good. Well, what we're going to do first, Mary, we're going to put some red water on your teeth. And what that red water will do, it will show us where the germs are.
Mm.
Open up real big, honey. Real wide for me now, Mary. Boy, you're doing so well. Are you sure you're only 3 years old?
Mm-hmm.
Uh-huh. I don't know. I think you're older than 3.
She sure is a good helper for 3 years old, isn't she?
Boy, she is just doing so well. Okay, that's good. Have a piece of gauze, please.
Detailed instructions for disclosing and scoring tooth debris are available in the Department of Pedodontics. This record is a motivational tool for better oral hygiene, not a scientific index.
Okay, and let's rinse her out real good. Now we're gonna take all that red water out of your mouth, and we're gonna take it out with a vacuum cleaner. Can you open up real big?
I'm going to spray a little water in.
This is our, just water. Okay, and we're going to make the chair go back just a little bit more, Mary. Can you put your chin up for me real wide? Mirror and explore. Okay, Mary, this is a mirror, and we use the mirror to count your upstairs teeth because we really can't see them unless we look through a mirror. And this is a tooth counter. Okay, open real big, Mary. A, lingual buccal. B, buccal. Distal, lingual. C, buccal. Lingual. D, buccal. Mesial, distal, lingual. E, mesial, buccal, distal. F, mesial, buccal, distal. G, mesiobuccal distal. H, mesiobuccal distal and lingual. I, mesiobuccal distal and lingual. And J, the same, mesiobuccal distal and lingual. Okay, chin up real big for me, Mary. Open real wide. K, buccal, lingual. Thank you very much. Okay, do you have a mirror? Let's show Mary where some of these germs are on the teeth. And then we're going to show you how to brush them off.
Can you see, Mary, if I hold the mirror on here?
Can you see, Mary? See the red?
Mm-hmm.
Okay, those are all the areas we want to teach you how to brush real clean. And Paulette is going to teach you how to hold a toothbrush and exactly how we want you to brush your teeth. And while she's doing that, I'm going to go talk to your mom for a second.
Okay.
Okay. You've been a big, big helper so far. I'll be right back. Hi, Mrs. Rogers. Boy, Mary is doing real well. Just no problem at all. Did you have any trouble filling out any of the forms that we asked you to fill out? Okay. What we just like to do now is briefly go over the medical history, and it appears that Mary is very healthy, so we don't have too much really to talk about. One question I would like to ask is, what is your main reason for bringing Mary in today?
For a routine check.
Okay. Has she ever had a history of rheumatic fever or a heart murmur?
No.
Any allergies that you know of that you'd like to discuss? And any bleeding tendencies that you would know of at this time? That's really all I'd like to talk about right now. Briefly, what we want to do today, we will clean Mary's teeth, and we'll check them over real carefully, and also take radiographs. And then after we finish with everything, we'll sit down and just talk briefly about any of Mary's problems, if she has any.
Fine.
She's doing real well.
Now let me see you do that in your mouth. Can you watch yourself in the mirror? And start weighing the back. That's a girl. And brush around with the little circles all the way till you get to the front. That's a good girl. Real good. Okay. Can you do this other side now? Can you open up real big? That's a girl. Now we can see. Brush around and around. Can you look in the mirror, Mary? All the way until we get to the front. Okay, that's real good. Now, the fronts of our top teeth, okay? You want to watch me for a minute? Okay, we take our toothbrush, put it on our teeth. We start by making our little circles around and around and around and around and around and around. And it really helps if you look in the mirror when you're doing that, okay? Because you can see exactly where your toothbrush is going. Okay, can you look in the mirror? I'll help you. Okay, can you put your teeth together? Can you put them together? That's a girl. Let me see them. Can you look in the mirror, Mary? Are you looking in the mirror? Okay. Round and around and around and around. I want you to take your toothbrush and see if you can do that. That's a girl. Well, that's really fine, Mary.
Boy, you're sure doing a good job, Mary.
She sure is, Dr. Pink.
Okay, I think that
Okay.
looks real good.
Thank you.
These are the records. You can just set
Fine.
those back there. Did Paulette show you how to brush your teeth? Completely the right way, huh? Gonna make the chair go back a little bit, honey.
Yeah.
Let's move that up just a bit. Okay, let me see how clean they are. Open real big. Good girl. See, it's gonna go down a little. Back's gonna go down. That's perfect. Okay, what we're gonna do now, Mary, we're gonna brush your teeth with the electric toothbrush. And this is our electric toothbrush. And this is made of rubber. And this spins around. It's going to feel just like this. And we put toothpaste on it and spin it around on your tooth. And it gets your tooth real clean. And this is some toothpaste. Just a special kind of toothpaste. Okay, keep your head back, honey. Open real big. Can you put your hands in your lap for me?
Is she back far enough for you, Doctor?
Yeah, I think I'd like her back just a little bit more. We're going to put the chair back just a bit more. Good. Open real big. Now can you close just a little bit, Mary? Close. That's a girl. This is going to spin around on your tooth, and boy, is it going to get clean. Oh, you're doing so fine. Doing just perfect. Where did you get to be such a big girl? Do you help your mother at home like this? Okay, you've done very well, Mary. Now what we're going to do is we're going to count your teeth, hon, and just check and make sure everything's okay and your teeth are real clean. Okay, do we have a rinse, please?
Surely.
Open up real big, Mary. We're going to put the vacuum cleaner here and take out some water.
That's a girl.
That's perfect. Okay, very good. Okay, let's start with the exam. Oh, your nose looks pretty good. Do you know that?
Extra arm.
Fine, everything's normal.
Interarm.
Can I have gauze, please? Do you have a scratch up there or something, huh? Okay. Marginal gingivitis? Open up real big, honey. Could I have a mirror, please? This is our mirror to look at the upstairs teeth, hon. Can you stick your tongue out for me? Good girl. Put your tongue way up here. Can you put it way up there, huh? Open up big. Open up real big. Okay, everything looks real good. Okay, head back, honey.
Class 1, 2.
Okay, could you take the mirror? Okay, honey, bite your teeth together. Bite in your back teeth. That's a girl. Okay, class 1. Open, open. Thank you. Bite together again, honey.
Okay, overbite and overject.
Bite together, honey. Okay, about a millimeter each way.
Okay. Available arch space, adequate, borderline, or inadequate.
Open up, honey, real big. Okay, I'm going to say borderline to inadequate here. Let's say inadequate. She doesn't have real good spacing. Boy, you're doing so good.
Crossbite?
Bite together, honey. That's a girl. No,
Habits.
everything looks real good. Okay, open again for me, Pumpkin. Thank you.
I can't.
Open real wide. Ah, good girl. Okay.
Orthodontic disposition?
I think we can observe in the children's clinic.
Right.
Is that what you think, too? Okay. Let's go right ahead and open real big, honey. Once again, this is our mirror, and this is our tooth counter. And we're going to use the tooth counter now to count each tooth and see if it's nice and clean.
Okay, we're going to dry off your teeth with the air, like we did before.
Open up real big, honey.
Open up real big.
Let's just air. Okay. First of all, she has all primary dentition. Open up real big, hon. Good. A surface 5, surface 6, B surface 5, C no caries, D no caries, E no caries, F no caries, G no caries, H, a little hypoplasia on the labial. Open up real big, Pumpkin. Thank you. I surface 5. J surface 5. Okay, diagnosis. Pitt and Fisher caries. Bite together, honey. Behavior excellent. Thank you. Okay, Mary. Now that we're all finished counting your teeth, what we're going to do is we're going to go take some pictures.
In the age group 3 to 6 years, the standard radiographs are upper and lower number 2 anterior occlusals and right and left number 0 posterior bite wings.
Okay, Mary, we're going to take our pictures now. This is our camera, okay? And this is our film. And this is just a little piece of cardboard. Do you want to feel it, Mary? Okay. Now, what we're going to do, I'm going to put this in your mouth, and we're going to have you bite down on it. And when I say bite all the way down, we want you to close just like that. Okay, open real big. Okay, bite together. Close. Good. Now, chin. You're going to make you cough a little, Pumpkin. Chin down. Chin all the way down. Good girl. Good girl. It's going to make you cough, but we want you to bite on it. We want you to bite all the way down. Open big. Close. Good. Now, keep closing. Keep closing. Breathe through your nose, Mary. Keep closing. Hold real still. Hold real still. Good. Good girl. Okay, open real big. Open real big. Hey, you did real good. You did real good. Now, we're going to take a side picture. We're going to have you bite all the way down on it. Okay. The side picture is a little bit different than the front picture. And what we want you to do is bite on this part right here.
I feel it.
Okay. See? We're going to fold these in so they won't make it a little easier for you. Okay, open real big for me, Pumpkin. Now, got to look straight ahead and got to keep your chin down. That's a girl. Now open real big, just like that. Now bite together, bite together. No, open real big, Mary. Now, got to listen to me very closely. When I say bite all the way down, that's when I want you to bite, okay? Open up real big. Now, don't, okay, now bite, all the way down, all the way down. Good girl. It's going to make you cough a little, but keep biting. No, keep biting, keep biting. You're doing real good. No, keep biting. Chin down. Remember, chin down. Chin down. Okay, open big, honey. Open big. Oh, that one made you cough a little, didn't it, Pumpkin? Here, let me take a look. Let me just dry those eyes a little bit. Okay, we're going to try it again. You know what that means? That means I got to bend it a little more. That's all. Okay. Straight ahead. Straight ahead. Now on this one, I want you to bite all the way down because we can do it. Okay, open real big. Good. Good. Keep biting. Chin down. Chin down. Good girl. Good girl. Keep biting. Keep biting. Okay, Paulette, we're all finished with the pictures, and Mary did real well. Could you take her out to see Mom now?
Sure.
Thank you for being a big girl, honey.
Oh, Miss Rogers. Hi. How'd you do?
Daddy.
All through for the day, and Mary Carol did a really nice job. And what we did this morning is we taught her how to brush her teeth. And we'd really like for you to help her brush her teeth every day, at least once a day, and supervise her brushing. And there are also some disclosing tablets in here to help you, and some toothpaste. Okay? I'll let Mary hang on to that. And Dr. Pink will be with you in just a few minutes. All right. Thank you. Bye-bye.
Bye. No,
What
I
you having
am.
there? What are you having there?
Hi, Paulette.
Hi. Here are your radiographs.
Okay, thank you. As soon as I finish reading these x-rays, I'll go out and talk to Mrs. Rogers. Why don't you begin setting up for the next patient?
Fine.
Was just a big girl for us. She does have a few cavities starting in between her teeth, and because of this, I would like to take a diet history. And what this consists of is just a period of 5 days. And we'd like you to fill this sheet out for us over a 5-day period, and please include a weekend if you could, because diets sometimes change on the weekend. It's pretty self-explanatory. Right here are the instructions, which we'd like you to read carefully. And this is just an example of 1 day's recording, okay, of how we'd like you to do it. This is not an example of a good diet, but this is just an example of a day's recording. And would you please stop at the desk and just make sure all the appointments have been made, okay? Thank you very much.
The preceding presentation accomplished all of the major steps required for completing a preschool child's first visit to a dentist. Clinical and radiographic findings may now be synthesized for treatment planning and scheduling of future appointments.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.